Let's talk about something that could transform care in your hospital, even if you're working in a low-resource setup. It's about clinical governance. Now, clinical governance is about accountability. It's making sure that patients get safe, high quality, and consistent care within our facilities. So how do we ensure that this happens? This is very simple. One, make sure that your staff are well trained. Then two, make sure that you have clear protocols within your facilities so that people can easily know how to respond, especially when you have an emergency at hand. Then three, make sure you have an organogram so that people working within your setup will know how to report, especially when they have issues, who to report to and how to make the report. And also ensure you have an audit system. Any system that is not audited is a system that is bound to fail. So we should audit our processes, audit patient care, audit procurement system, audit staff behavior. So that will help you to know how to get to the next level. And also you should also ensure that you receive patient feedback. And it's better if the feedback is anonymous. So that helps them to give an unbiased feedback. Most times when we patronize the private sector, especially facilities, when you use facilities like the e-hailing taxi system or even e-markets, most times you see that they always request for a feedback at the end of the day. And hospitals where we take care of patients, where we handle lives, shouldn't be left out. So every hospital should have an exit form that every user should fill. It may be a physical form, it may be an online form, but that helps you to know where you are getting it wrong and also will help us to know how to get things right. So clinical governance is just about safety. It's about accountability. We don't need fancy tools. We don't need high-tech skills to get that done. What we just need is the willpower to be able to put that through, and also the enabling environment, the laws to enable enforcement. Because when you have a governance system in place, if it's not enforced, if there is nothing like monitoring and evaluation, then the system may not still perform the way it should. So it should be put in place that you have a monitoring system, and also it shouldn't be punitive in any way. Errors should just be detected and corrected, and staff should be trained to know what they should do and how they should do that. And if we do that, we'll be able to prevent the avoidable deaths and avoidable problems that we've been noticing in our hospitals. So even in low resource settings, clinical governance can be done. So let's put that in place and we'll see things change for the better.
Please subscribe. Please subscribe.